In this episode of Ask Dr. Zack,
I can hardly make it up these stairs because of the arthritis in my legs. It is painful for me to take every single step. Ow! It's very hard for me to walk in those high heels.
and later,
I've always had back issues.
All right.
Post-pregnancy, they've come back with a vengeance. I am concerned about what will happen in the future because it seems to be getting worse.
then on the doctor's orders,
Don't come to the emergency unless it's an emergency. If you come to the emergency and you have a stubbed toe, you're just going to have to wait.
In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zack, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small.
Today we're discussing arthritis. Millions of people live with a form of arthritis. It's a disease of the joints, and symptoms include joint pain and swelling. Osteoarthritis is the most common form of arthritis. Let's learn a little bit more and take a look at the Blosson medical animation.
In order to understand the changes that occur in the joints of a person with osteoarthritis, it is necessary to first understand how joints work. The two main bones of the knee are the femur and the tibia. In a normal knee joint, the connecting surfaces of these two bones are covered with cartilage, a smooth and strong material that cushions the impact between the bones. The joint is also surrounded by synovial fluid, which aids in joint mobility. In people with osteoarthritis, there is a chronic degenerative loss of cartilage, resulting in bone-to-bone exposure, bone destruction, inflammation, and pain. Osteoarthritis can affect any joint in the body and is commonly found in the neck, back, and hips. The cause of osteoarthritis is unknown, but aging plays a significant role in the development of this condition.
And we'll be right back to speak with a few people who suffer from arthritis and talk more about it.
up next,
I can hardly make it up these stairs because of the arthritis in my legs. It is painful for me to take every single step. Ow!
all this and more right after this short break. Arthritis is the #1 cause of disability, with nearly 1 million hospitalizations annually across North America. Arthritis costs over $156 billion in lost wages and medical expenses, with more than 50 million adults suffering from this debilitating autoimmune disease. 57-year-old Christine Acray struggles with arthritis daily.
My knees hurt here and above and below. I can hardly make it up these stairs, and this is a beautiful wooded area right beside where I live. This is a park I used to go to all the time, running up and down these stairs. And right now, because of the arthritis in my legs, it is painful for me to take every single step. I'm having to hold on with two hands. Sometimes I have to wear high heels for work or for an interview or for a business meeting, and it's very hard for me to walk in those high heels. Ow! So I'm just hoping we're in a boardroom, we're sitting down, and they're not having to watch me walk in and out. Also in the evening, you're wearing a very fancy dress, you're at an event or a charity. You don't want to wear flat shoes. I'm trying to cross a street, they're not even stopping for me. And now I see the numbers coming. I don't even know if I can make it in time. I just have to hope that the drivers are kind enough not to run me over when the zero comes up. It's limiting my mobility, and I don't know if there's anything I can do about it. I don't want surgery, and that's what I'm going to be asking the doctor about when I get to see him.
Now it's time to ask Dr. Zack.
Thank you so much for being here. So you're suffering, your knees are suffering, and that's limiting your ability to get around and your quality of life.
It is definitely.
How long has it been going on?
I think I started running when I was about 25, but I'd never run before. And I decided I'm just going to run like a 10K.
Okay.
And so that did it. Then they started hurting after that. Then I had multiple ski accidents.
Oh dear.
Well, you know, and I had is it the MCL or that joint toasted, and I went to physiotherapist, no help. I had the injections in my knees. What's that? What do they put? Steroids, cortisone? I don't know.
Most common is steroids, yeah. Cortisone is a steroid.
Yeah, so for like 5 minutes or a day, my knees felt great. I felt wonderful. Then it wears off.
Yeah.
You know, I don't think there's anything. I would love if you could help me find a way for my knees to feel better, because they're creaking and I'm slow walking and it makes me feel older.
Yeah.
So it's really limiting me in so many ways.
Well, we're going to try.
Okay, good.
So you mentioned you've had the injections.
Yes.
And by the way, is it osteoarthritis? Have they given you a diagnosis?
No,
Do you
they
know?
haven't. I went to the arthritis hospital
Yeah.
and they put you through all these tests,
Sure.
walk around the hospital 18 times and tell me if it hurts. Well, yeah, second time it hurts.
Yeah.
You know, keep walking. So, no, they said, well, we'll get back to you, right? So, but I don't think it was it was just on borderline, not serious enough to ask for a knee surgery, ask me if I wanted a knee surgery, but serious enough to see that I was in pain.
So what did they recommend? Aside from injections, anything else?
They said build up the muscles around the knee.
Which is good advice, you know, I'm sure you've tried, because the thinking behind that is that the more you have musculature around it, the less strain it actually puts on the knee joint itself. And have you tried anything else? You mentioned exercise, you mentioned injections, any medications at all?
Medications they're hesitant to give me, because how do you give someone a medication that just bypasses all those body parts and just goes right to that knee?
You're right. You know, and that's true. The problem with any medication you take by the mouth is it's systemic, you know, it goes in your whole body. And so I understand people not being too keen. On the other hand, you know, it's really limiting. So maybe it may be that a medication would help you. There's a couple of things I can think of. Exercise is one. Now, with respect to exercise, did you actually work with like a physiotherapist?
I did.
Okay.
Yes, I did. And I had acupuncture. I mean, I have
you've
done
done-
everything.
yeah.
I've done everything I possibly can.
Good. You mentioned like local therapy, like you had the injection. Did you ever have an injection of what they call viscosupplementation? It's basically injecting like an artificial cartilage to give the area some more cushioning.
Whoa, no. If I could remember that, I would mention it to my doctor.
I'll write it down.
Thank
I'll write
you.
it down for you. Because it's worth a try. And
Yes.
unfortunately, I mean, the steroid injections are supposed to last more than a day or two. But
Yeah.
you know, and some people, they just don't, you know.
I know.
But they're
And
supposed
are
to
you
last months.
Yeah, well, are you supposed to go in like every couple of months and have steroid, and then all of a sudden it starts hurting, you get steroids again, and...
Well, some people do it regularly. You can't do it more than about every 3 months.
Yeah.
Because it can actually, too much steroids do have side effects. And if
I
you have too
know.
much of them, it can actually cause problems, and it can also cause breakdown. And you mentioned you'd had trouble with your MCL in the past, so you don't want too much. And you mentioned the high heels.
Yeah.
I mean, high heels are I'm not a big fan. Personally, I think running shoes, or at least, you know, comfortable shoes. Actually, for knee and hip problems, they do recommend certainly comfortable shoes, not high heels, and also well-padded shoes. Because any kind of padding you can add
Yeah.
because you're missing some padding potentially in your knees can potentially help them.
How about what the podiatrists recommend, the orthotics?
Yeah. And
What
some
about that?
some people it helps for sure.
Yeah.
It really depends on, because sometimes arthritis is actually due to a fact that there's a little bit of malalignment.
I think so.
Oh yeah? Yeah, some people do have joints that they call it you can be bow-legged or, you know. So,
I'm splay-footed, I think. So my knees go down like this, and then my feet go, eek.
oh yeah. So there's basically, the doctor terms for it is varus or valgus, but basically if you're not putting the pressure directly on both sides of the knees, then it causes more strain on one side.
Yes.
And orthotics can help with that by building up one side so the knees are not being pressured all the time. So one thing I would say, Christine, is don't give up. Never give up, you know?
Yes.
I mean, you're healthy, you're young, you know, you have many, many years. You have to keep trying. And unfortunately, especially for things like arthritis, it often ends up being a process of elimination. And sometimes it's frustrating because it takes a long time, but there is something, you know, there's something that'll help everyone.
Oh, good.
And so we're going to get there. Now, I think it probably would be a good idea. I know you're not a big medication person, and I'm not trying to push them, but at least to take some kind of painkiller, even just acetaminophen, aka Tylenol, regularly, just to give you, because you do need at least the pain control for long enough that you can do your activities of daily living and get some exercise in.
That's a brilliant idea.
Oh, well, thank you very much.
You're welcome.
and there are other medications as well. If you can take anti-inflammatories, in some people they're very, very helpful. There are potential side effects like any medication, so you have to talk to your doctor about what's good for you.
Yeah.
Well, we got to get you back to the point where at least you can walk quickly up and down.
That would be lovely. I would love that.
Okay, great.
Now, Dr. Zack's prognosis.
Christine has arthritis, specifically of the knees. So if we look at our friend over here, basically the cartilage, which is a soft tissue between the bones, the big bones in the knee, has run out. So now the bones are rubbing against each other, and that's causing a lot of pain. I have two recommendations for Christine. Number one, stop with the high heels. They're not helping her, they're making her worse. She needs nice, supportive, cushioning shoes. Number two, she's got to lose weight. She's got to lose weight somehow. She's going to have to cut down on her caloric intake, and she's going to have to increase her activity level. Now, I know her knees hurt, so she's going to have trouble with the walking and the running. She can do other things, as I've mentioned. She can swim, she can do elliptical. She's got to do something to get her heart rate up regularly. And then if those things don't work, she can try other things. There's that visco supplementation that I mentioned, an injection. But start with stopping the high heels and exercise. I think those two things will help her a lot. She'll lose weight, she'll feel better, and her arthritis pain will go way down.
Now, let's ask Dr. Zack about the most common chronic condition in Canada, back pain.
The vast majority of us experience back pain at some point in our lives. Most acute back pain is caused by a sudden injury to the muscles and ligaments that support the back. Other causes of sudden lower back pain include compression fractures, a ruptured or herniated disc, sciatica, and spinal stenosis. Let's take a look at the Blausen medical animation now for a more detailed perspective.
The spine consists of 33 vertebrae that protect the spinal cord and provide stability to the torso. The lower section of the spine is called the lumbar spine. This section of the spine is the most common site for back pain. Low back pain is generally classified as either mechanical or compressive. Mechanical pain is usually referred to as back strain due to its association with the movement of the spine. This type of pain is the result of injuries to the spine's facet joints, discs, ligaments, or muscles. Compressive pain is irritation or pressure placed upon the nerves, most likely due to ruptured, herniated, or bulging discs. If you have low back pain, it is important to visit your physician for a proper diagnosis in order to determine the type of pain you may be experiencing. The physician can then recommend appropriate treatment.
And we will be right back with more Ask Dr. Zack.
Still ahead,
I've always had back issues. All right. Post-pregnancy, they've come back with a vengeance. Charlotte there? Where's Charlotte? Show me Charlotte. Post-pregnancy, I've been getting a lot of back issues with lower back issues, sciatica, and obviously trying to exercise or go back to getting active. We haven't been able to really find a solution because the doctors haven't been able, they just keep telling me to exercise and strengthen the back with exercise.
She's worn out.
It's this portion that hurts. And then obviously down here for the sciatica. And the shooting pains are in the front, lower abdomen area.
Sorry.
Oh, Cinderella, did you lose your shoe? I've always had back issues, but they disappeared during pregnancy. And post-pregnancy, they've come back with a vengeance. It affects me from a daily living perspective because we are out and about. We live in downtown Toronto. We don't own a car. We walk everywhere. When we go out to festivals or events, I'm constantly looking for places to sit down for a bit. What shape is this?
It's a triangle.
Okay, so then it'll form a triangle. I've been trying to do a couple things. Lots of back exercises with tennis balls. I was doing yoga for a bit, Zumba lessons. But the Zumba is actually hurting me more than helping me. I am concerned about what will happen in the future because it seems to be getting worse. So my gut tells me, no pun intended, that there is some other issues at play, and I would love to hear Dr. Zack's opinion on how I can get better and stronger as far as my back's concerned.
Now it's time to ask Dr. Zack.
And thank you very much for joining us, Yashi.
Thank you for having me.
It's a pleasure. So you tell a story that I think will resonate with a lot of people. I think a lot of people suffer from back pain, and certainly related to pregnancy. Some people it gets worse in pregnancy. In your case, it got better, but now it's worse.
Yes.
How has your back pain evolved since you gave birth?
It had disappeared for a good 2 years between the two pregnancies, but now it just keeps getting worse.
Have you noticed what brings it on in specific activities?
Just walking a long time, standing, cooking, complex dishes, yes.
Yeah. And you mentioned you also get sciatica type pains, eh?
Yes, and that's shooting pains mainly on the left side.
Okay.
And that's happening more frequently as well.
But something a little unusual is that it radiates around to the front, you were saying.
Yes.
And is that all the time? You always get them at the same time, or not
It's
necessarily?
honestly, this week in particular has been worse, and I'll get it at least a couple times, like 3 or 4 times a week, especially if I'm lying down, if the kids jump on me, or if I'm lying, sleeping and try to flip, I get shooting pains in the bottom.
There's a few things. Number one is if it's persisting a long time, which it is, and it's not getting better, even though you're doing all the things you need to be doing. So again, you really have to make sure you're optimizing the exercises and the stretching and the strengthening, and make sure that someone gave you the right kind of exercises to do, because sometimes people can do, some exercise. The doctors say, oh, okay, exercise. People will do it for a year, but they're not actually doing what's going to help their back. So by strengthening the muscles and the ligaments around the spinal cord, it takes some of the strain off the actual spinal cord and the discs and the vertebrae, and that can be quite helpful. But again, you need a specialist to tell you the kind of exercise to do, like a physiotherapist. If necessary, sometimes medications are useful for a brief period of time, at least to control the pain and or to control inflammation. And that can be either topically, like sometimes there are some rubs you can put on just to relax the muscles. There's pills you can take that are just like acetaminophen, which is also known as Tylenol for the pain, or anti-inflammatories. If things are persisting and you're really not really sure what's going on, then the next things to do would be further imaging tests. And I'm talking about really the best imaging test to look at the spine and the spinal cord is an MRI. If there's a question of whether it's something else, like something, because sometimes back pain is actually radiating something in the abdomen or the pelvis that's radiating into the back.
Yeah.
And so that's something you may want to discuss with your doctor. Could it be something else? In which case, testing would actually be different. They would actually be, aside from a physical examination, your doctor would check you out. I'm sure they already have.
Yes.
They would also want to do things like a blood test and or a urine test, possibly an ultrasound and or a CAT scan, that sort of thing.
Okay.
So all those things are possible treatments for you.
Okay, thank you.
Now, Dr. Zack's prognosis.
So Yashi came to us complaining of lower back pain, which has been ever since she had her last child. Now, there are a couple of issues there. Number one, she is very active, which is important, but she's lifting her kids all the time, which probably isn't helping her lower back. The real issue here is Yashi has had trouble losing weight from her last pregnancy. It's very common, but there's no real getting around the fact that she needs to lose weight and she needs to be physically active in order to improve this. So she needs to eat less calories than she expends, do a lot of exercise, and strengthen her core muscles. So that means her back muscles and her abdominal muscles. And she'll find over time that this will definitely improve the pain that she has in her back.
Don't get your blood pressure up. We'll be right back.
Doctor's orders are, don't come to the emergency unless it's an emergency. The reason is, we have to see the people who are dying first. So, if you come to the emergency and it's busy, and you have a stubbed toe, you're just gonna have to wait. Now, pain is important, we'll treat your pain, but you won't necessarily get the real treatment that you need until we have stabilized all of the patients whose life is in danger. Keep that in mind next time you're thinking of going to the emergency department.
Now it's time for you to ask Dr. Zack.
Does anyone have a question?
My name is Drina. I worked in the insurance industry. Dr. Zack, what causes tinnitus, and is there a cure for it?
For people who don't know, it's basically the sensation, the sound. People hear something even if there isn't something there, and it can be constant. Typically it's a ringing, but it doesn't have to be a ringing. It can be all sorts of different sounds, and it can be really annoying to people. One of the important things actually is to figure out what the cause is, and that really is very helpful in terms of the treatment, because if you can stop the cause, you can figure out a reasonable treatment. The answer, there's no medications, unfortunately. There's no really good medications. People have tried different things, but the most important thing really is to get seen by a specialist in the area, and that way they can figure out exactly what the cause is, and hopefully by treating the cause, you can get rid of the tinnitus.
Thank you.
Thank you very much. Anyone else with a question?
Hi, Dr. Zack. My name is Gail. I work in the market research industry. My question is, I've noticed that as I get older, I'm having digestive issues. One of them is with digesting breads. Is this normal getting older? Or do I really have to change my diet around?
So it's a good question. And so I wouldn't say it's normal with getting older in terms of having digestive issues, but it's definitely normal to have changes. So it's not unusual that you can be at any age and suddenly, for some reason, and it's true for allergies too, strangely enough, you can develop them at any age. So as to what the cause is, that's what you really have to figure out. Now, gluten is in the media a lot these days, and people with celiac disease really can't have gluten. But a lot of people who can have gluten have decided not to have it because they feel it has some other effects and it makes them feel not well. It's possible. I mean, so it's definitely worth a trial of stopping gluten to see if that helps you. But what I would say is, more importantly, is to try and figure out, first of all, one important thing is to have like a food diary, see exactly what you eat and what symptoms you have afterwards. And then either by testing or by a process of elimination, you can figure out exactly what you're having trouble digesting. And then you can just limit that, so then you don't have to limit your whole entire diet of bread. And that's all the time we have for today. I want to thank my guests for coming in. I want to thank the audience for being here and for some great questions. And don't forget to join us again on the next Ask Dr. Zack.